Hello, I'm Armida Carr, bilingual speech-language pathologist, owner, and founder of New Horizon Therapy. Welcome back to Therapy Thursday, where I talk about a topic as it relates to speech or occupational therapy. Today I will be talking about tongue ties and what they are, what we can look for, and how we can help. So a tongue tie is usually discovered in infants, sometimes a little bit older in toddlers, but when there is a tongue tie, it's basically at the bottom of the tongue, we have a little string, the lingual frenulum, which is a little piece of tissue that is just either too tight or, and it's just, or either instead of attaching itself to the back, more towards the back and of the mouth or below, underneath the tongue, closer to the tongue in the back where it sticks out, that little tissue comes forward, attaching itself almost sometimes even as close to the teeth. So when we see these in infants, we know it affects swallowing, the way they eat. They sometimes have a hard time latching on to the breast when they're feeding. They have a hard time with bottles or, putting that tongue completely around the nipple of the bottle or the mom's breast and putting the lips completely around it. So it starts affecting the nutrition they're taking in. And sometimes I hear, my child's so colicky, so they're suctioning in more air than they should be. And a lot of times, for me, that's a red flag to look into the mouth and see if that tongue is attached. So it affects swallowing. It also affects speech sounds or ability, because for some sounds like the L, T, D, N, those are sounds that we have to lift the tongue up to do those sounds. So if kids have that tongue tissue that's too short, when it comes time for them to say these sounds, it's very difficult for them because they just can't get that tongue lift. Even the S and the Z or the sh and the ch, those are sounds that we have to pull the tongue back. And again, there's that restriction that's not allowing for the tongue to go back. So those are some of the things that we look for. And, if it's something that's not taken care of as an adult, it also affects our oral hygiene. Because when we're eating, after we eat, it's very typical for adults to clean any leftover food after we chewed and swallowed, to clean the sides of our mouth using our tongue and, just kind of cleaning our teeth, getting the food out. And if our tongue cannot reach those spots, that food or the debris in our mouth can stay there. So now we create cavities, bad breath, just because the food sits there and our tongue is not able to clean it out. It also affects some people socially, just kissing or talking or, licking, even licking an ice cream, so it can affect other things. And again, I've seen this in both children, infants, adults. So if you have any questions about tongue tie, and the last thing I will say about that, for us, for speech-language pathologists, we can look at the tongue, we can see what it's doing, and we always refer our patients out to a primary care doctor who does tongue tie releases, and for them to have a second look and to make sure it's, we're kind of on the right path. So we work together as a team to make sure that we're getting the best out of speech and the best, for the client, whatever is best. So anyhow, I hope I answered the questions, or I talked about it and with a good understanding, made it clear for everyone. But if there's any questions or any concerns, or you're just like, hey, I'm an adult and I keep cleaning my mouth with my finger, can you help? That might be a sign of tongue tie. But anyhow, thank you so much for joining me today, and I look forward to seeing you next Thursday.